We're inviting the audience to stand with us and say the Pledge of Allegiance. Thank you. Thank you, members of the audience, for joining us. I believe we have a quorum, and we'll go forward with our testimony. Our first presenter this morning is with the Minnesota Wing Civil Air Patrol, Colonel Slowinski. If you could come forward to do your presentation, we'd look forward to it.
Good morning, Senators.
Good morning.
Thank you very much for inviting me to do this presentation, Senator. I appreciate it.
You're welcome. Please identify yourself for the tape and proceed.
I'm Colonel Kevin F. Slowinski, a member of Civil Air Patrol. I am a 20-year Air Force retiree, so I am interested in the Veterans Committee. I flew the North American F-100 Super Sabre in combat in Vietnam. I'm a 50-year CAP member, past Minnesota Wing commander, currently the Minnesota Wing Government Relations Officer. My presentation on Civil Air Patrol follows. CAP is a nonprofit benevolent corporation. It's incorporated by act of Congress. I've met quite a few of the senators before and appreciate their support for Civil Air Patrol as it's been in the past. It was formed December 1st, 1941, just prior to the U.S. entering World War II. CAP received a Congressional Gold Medal for service in World War II on December 10th, 2014. All 10 members of Congress were co-sponsors of this bill for the gold medal for World War II service. Minnesota led the nation as far as sponsors. Recently, Civil Air Patrol joined the Active Duty Air Force, the Air Force Reserve, and the Air National Guard as part of the total force. By being recognized as a total force, we're just trying to figure out the differences this will make in our operations. We are the auxiliary of the United States Air Force. We receive funds through Congress for our operations for the entire country. And we are administered through the United States Air Force. They provide the oversight to the federal funds for us. Our missions of Civil Air Patrol are search and rescue, disaster relief, homeland security, counter-drug. We have performed as intercept targets for Air Force aircraft, Air Force fighter aircraft. And since UAVs are not permitted by the FAA to fly unescorted in the continental U.S., CAP flies surrogate 172s so that the Air Force pilots that fly these UAVs can get practice in flying the UAVs. Also, another mission that has just recently come up out of the East Coast, CAP is escorting the UAVs to and from their military operations areas. CAP is for missions that our airplanes are capable of, CAP is the economic alternative. I brought a little chart with me, but it shows the different costs all the way from $120 approximately for using a CAP airplane to going up to a C-130 of $4,400 an hour to operate them. Since we are all volunteers, that does make our program a little bit more reasonable than the other programs. The other mission Civil Air Patrol has is aerospace education of the general public and of our members. We have a teacher program where teachers can join CAP as aerospace ed members, receive any materials they want of the CAP aviation aerospace materials, and also have an opportunity to get orientation flights in a CAP airplane. Our cadet program is a youth program. It's youth leadership training cadets in leadership training from ages 12 to 21. It's quite an extensive program, and I'll spend some more time on it later. The Minnesota Wing Civil Air Patrol has 22 squadrons in different locations around the state. Some of you are familiar with your local squadrons. We have 21 aircraft right now, but we had received some newer aircraft that were supposed to replace the older ones, so we are currently selling 3, I shouldn't say we, but the corporation is selling 3 airplanes to get us back down to our authorized number. So we will be 19 aircraft in the near future. We have 23 passenger vehicles and 1 FEMA command trailer. We have 1,361 volunteers performing missions for America in Minnesota. These volunteers do not get pay or benefits. It's all pure volunteer work. In fact, they pay to belong. They pay dues. They can retire, and of course, if they retire, they don't have to pay dues, but they don't get any other benefits. There's no additional benefits. Volunteer hours, the estimated value in 2014 was $3.9 million to the state of Minnesota, and in 2015 was $4.1 million to the state of Minnesota. We do receive a state appropriation from the state government through the airport fund, and that's $80,000. So there's a pretty good bang for the buck from Minnesota from Civil Air Patrol. Another item is we do bring money into the state. We bring federal funds into the state when we operate our airplanes, when we do maintenance on our airplanes, and we fly missions for the state, because the federal government does fund these, and we buy the fuel and oil and things here in Minnesota, and parts. In 2014, we had 8 search and rescue missions in Minnesota with 4 finds. In 2015, we had 6 search and rescue missions with 5 finds. We have 862 emergency responders ready to perform in Minnesota at the moment's notice. Communications. We have 18 VHF FM fixed repeater sites throughout Minnesota, which were purchased through federal funds and provide service to the state of Minnesota. We have VHF FM fixed and mobile transceivers throughout the state, which can communicate with other fixed transceivers. We have a single sideband radio network, which meets 3 times on weekdays to pass traffic. This gives us coverage over the entire country should the telephone system, the cell phone system, or anything else go down. We still have coverage in Civil Air Patrol over the entire country. When CAP arrives at an emergency, we increase the available resources rather than utilize and tie up the available resources. One interesting mission recently was up in the Little Falls area, where it just so happened we had our cadets up at encampment at Camp Ripley, and the sheriff had a missing person in the Little Falls area and wanted help, and asked us to provide him 50 people. The next morning, we had 50 people there for him, over 50 cadets there for him, searched the area he wanted to search. He figured it'd take a day and a half to search it. We finished it up in 4 hours. And so he was very happy with our performance, and actually came to the graduation at the wing encampment to speak to the cadets and thank them for their help. Our cadet program is leadership training, aerospace education training, They receive moral leadership training and receive emergency services training. They also get to operate the radios, which is good for them in for the future. They are eligible and do receive orientation flights in both the powered and the glider airplanes. And if they decide to, they can also go further toward their flight training through solo encampments and learning to fly using the Civil Air Patrol airplanes. The instructors do volunteer their time totally for the Civil Air Patrol. They do not charge the cadets for any of the flying that they do, any of the instruction they do either. Cadets can attend activities worldwide offered by Civil Air Patrol in many of the different fields that they may be interested in. Some of the things also, the main thing also, the top thing that they can do is the International Air Cadet Exchange. They go over to a foreign country. It's the whole encampment, it's a 2-week encampment, go over to a foreign country, spend some time in the foreign country with the foreign families, and then come back and go through Washington on the way, both directions. Our legislative squadron. We do have a legislative squadron. In fact, most of you are members, and we appreciate that. It's open to all legislators. There is no cost to the legislator. The legislative squadron members are not required to perform any activities, but they can participate in CAP activities. Legislative squadron members can fly on CAP aircraft. We have a few restrictions as to who can fly them, but other than that, that's due to the FAA regulations. Other than that, we can fly CAP members. In fact, some of you have flown recently. Legislative squadron members can wear uniforms. In fact, we prefer if you wear a uniform when you fly with us. All of you have received packets in the last week, or I have your packets are here to be distributed to you when you stop by to visit us over up on 3414. We currently have 104 members. In the last week, we've gained 16 members in the legislative squadron, so it's been excellent response this week. We currently have 104 members of the Minnesota legislature as CAP members. Do you have any questions for me?
Members, Senator Little.
Thank you, Mr. Chair, and thank you for the presentation and for your service. I just wanted to thank you for running this program. We have an airport in Lakeville, which is where I represent, and I got to visit with some of the students that were in the program, and it's really hard to get teenagers excited about stuff, but these kids were excited. I mean, and I got to see what they do and speak with them, and it's just a great program. So I just wanted to thank you.
Oh, great, sir. I would appreciate it if you join.
I'll fill out my application right now.
All right, sir. Thank you.
Senator Hall.
Thank you, Mr. Chair. Colonel, it's a pleasure having you here today.
Thank you.
Could you tell me the top 3 reasons that a cadet joins?
Colonel.
That's a very interesting question, and I would like to pose that to most cadets, but I personally, all 5 of my children have joined and were CAP members. I also have a couple of my grandkids that are currently members of Civil Air Patrol. I believe they join because of the chance to do something interesting, leadership, performance. They can give something back to the community. Our search and rescue program, learning search and rescue, the leadership training for their future. Some of them do join, I'm sure, for the military, get some idea of what the military is about. One of the things, we don't recruit for the military. That's not one of our purposes. But we are there so that if a cadet does decide at some point in time they want to go in the service, they're doing it with their eyes wide open. We have excellent results from our cadets when they go in the service through the academies and other things. Aviation, I'm sure. A chance to get in an airplane and fly, that's a big, apple out there,
Sure.
carrot. I joined Civil Air Patrol because I wanted to work with youth, but I was an adult, and I was in the Air Force already at the time. Our members are not all retirees, veterans. In fact, of the last few wing commanders, quite a few, three of them, I believe, had never served in the military at all. But they got involved in the program. Some of them got involved in the program because their children got involved in the program, and they dragged them in or got them in and got them interested in the program, and they've stayed in, just like me. I mean, I've stayed in because it's such a good program for youth. My daughter, my youngest daughter, went into the service. She served 20 years, and she retired as a full colonel out of the Pentagon. My youngest son is currently serving in the United States Air Force as an instructor pilot down at in Mississippi.
Senator Hall?
Thank you. Just follow up, Colonel, thank you. I've noticed in participating that the youth that are involved with you are very mature young adults.
Thank you, sir.
Or youth. And they have to have good reasons to want to go into a leadership program like that. Yeah, and there's maybe some reasons to fly, but I've really appreciated meeting some of them, participating with you. Can you tell me, as a member of the Civil Air Patrol, what my rank is?
Colonel?
Yes, sir.
Go ahead.
Your rank is major, sir.
Thank you.
That can be debated. Senator Lang?
Morning, Colonel. Thanks for the presentation. You showed the cost savings chart, and I know you didn't show that very in-depth.
No.
With my experience flying within the state, doing some search and rescue operations myself, know what we cost an hour. And with the benefit of the cost savings that you're showing, what are some of the areas you think the Civil Patrol could be expanded? What are some of the areas you'd like to get into?
Colonel?
We have worked in the last few years with the DNR, and we have an agreement with them that if, for example, part of their operations funds flights for fire, searching for out fires, and they rent airplanes from civilians. We don't compete with the civilian population. We're not there to compete in industry. But if they become overwhelmed and they can't handle it, the DNR does know they can come to us and request our assistance. We're looking for more missions. We are definitely open for missions. Our search and rescue mission in recent years has dropped off to where it's very rare that we get these big missions like we've used to in the past because of the new ELTs that are out there. These new ELTs, if an airplane goes down and if they've got a new ELT on board, it immediately transmits their GPS position, the tail number of the aircraft, who owns the aircraft, what their home address is, and what their phone number is. And so it's not as hard. They don't have to send us out to spend 15, 16, 20 hours, 2 days, 3 days, or I've been on 2-week searches. The Mike Bradley search. I'm not sure how many of you are familiar with the Mike Bradley search a couple years ago. That one was different. We did not have an ELT on that when Mike Bradley went down. In fact, we still have not found Mike Bradley. And we searched over 2 weeks, looking for Mike Bradley up on the Duluth coast up there in the Lake Superior. And we're not successful in finding him, which is too bad. He flew a twin-engine airplane and disappeared.
Senator? I guess the follow-up to that would be the continued firefighting that goes on within the state. Some of the DNR air attack that operates in the state. I'm curious if you would like to be involved with that, and if it's possible to get involved in that.
Colonel?
We are volunteers, and our missions are we our volunteers have to have the time. That's another thing.
Yeah.
When we have a mission, we call out to everybody to say, see who can make it. If they can get off work, they do get off work and do it. We don't have any employees. Well, I shouldn't say the corporation does have employees. We have one in the state of Minnesota, and he's administrative. So we don't have, it's a little bit tough. We perform when we can, and we do what we can as volunteers. If it was a steady day-to-day mission, that might be a little bit difficult to manage, but we would try. We would give our best to do it.
Thank you.
Any other questions? Colonel, I have a question.
Yes, sir.
Men and women, what's the percentage of men versus women that belong to the Civil Air Patrol?
I do know there are a lot more men than there are women in Civil Air Patrol, but we do have quite a few. We have a few squadron commanders right now that are the squadron commander of Mankato, the squadron commander of Brainerd Crow Wing Squadron. They are women. We have women throughout Civil Air Patrol. Like I said, I joined CAP originally because I had 2 kids on the ramp and 1 in the hangar, and she hit the ground the month I joined. And all 3 of them were 3 daughters. I wanted to be active with them, and I knew I could do that in CAP. And it would be something I could work in. And so that was one of my main reasons for joining Civil Air Patrol, was to be able to work with youth of both sexes.
Colonel Slawinski, thank you for your testimony. We have to keep moving here, so. Oh, one more question, I'm sorry. Senator Schoen.
Thank you, Senator, and I apologize. Colonel, apologize for not being here at the beginning of in your vernacular. My 2 on the runway, I had to get to school, and it's not been so great this morning. But so the Civil Air Patrol, their training and main base is down in my district at the South St. Paul Airport. And what I just wanted to bring out to the committee, if you didn't get a chance to touch on it, is that there's some training facility needs that we're going to try and continue to work on with the folks, and that I expect to have before the committee again, at least to continue this conversation. It may have not it didn't come up last year because we had some difficulties in communication with everybody trying to understand where and what was exactly needed, and we think we've maybe gotten closer to that. So I just want to highlight that here. They do a great job, and they have some facilities that really need to be upgraded in a big way. As Senator Lang would know better than anybody in this realm of flying, and what you need for maintenance as well. Yeah. So I appreciate your time very much so.
Thank you, Senator Schoen.
Thank you very
Colonel?
much, sir. Yeah, thank you, sir. I did not specifically bring it up since we did not have any bill or anything developed at this point in time. Thank you, sir.
Thank you, Colonel. Appreciate your being here today.
My pleasure, sir. Thank you all.
The next presenter is with the Eagles Healing Nest. If they would come forward. Good morning. If you could identify yourself for the tape and proceed with your testimony. I appreciate it. Thank you.
Melanie Butler, founder and director of Eagles Healing Nest in Sauk Center, Minnesota. Thank you for having me here today. I got a phone call at the end of last week, so I was a little bit surprised, but we made it this morning. So we are still creating the nest. 4 years ago is when we first opened our doors in September of 2012. It was created by veterans, military members, and their families with a strong community support, and that's how we continue to operate today. We just believe that if we gave them a place to heal, that they could do so with honor. And in the 4 years, we have grown and expanded. We started housing 22 veterans. We now house 70 veterans, call our nest home. And we do have a waiting list, and that waiting list can range anywhere from 7, and we've had it as high as 22. It was started, as some of you know, because when my family did 4 deployments out of Minnesota with the National Guard, my oldest son was suicidal. and the entities that were supposed to take care of him and protect him turned him away. Tragically, I can tell you that that still happens today. The statistics can be what anyone wants them to be. And so I don't believe that any entity should be patting themselves on the back because they lowered the number to 20 or 21. Those of us that have our boots on the ground, that don't check a box, that don't do any of those, know that that number is much higher than even the 22. But we don't give up. 2 years ago, we placed the property. We no longer lease it. It is owned. It's in a charitable trust, forever to be theirs. They're creating it, and they get to keep it. We do lots of our things on a peer-to-peer model. We also have clinicians that come in and work. The University of Minnesota, as well as the Mayo Clinic, sends interns up to assist the veterans in any way that they can, but also for the veterans to educate them as to the issues that veterans have within the clinical model, the medical model, the physical models, such as TBIs, PTSD, anxiety, and depression. Opiates are still a huge issue with our veterans. The large doses of medication given to them to heal. I just did another call 2 days ago of a mom panicked and not knowing what to do. Her son is on a large dose of medication. I understand I'm not a doctor or a clinician, but it doesn't take a rocket scientist to know that your body can't handle some of those medications when they get into 12, 20, and 33 is the highest amount of prescriptions that I've seen one veteran get. And that's tragic. And the fix for that is not to send them the pen in case they overdose. That's kind of an oxymoron in my book. But regardless of what those entities do, our nest just continues to grow. Since I was here last year in front of a different committee, we have saved many from suicide and from homelessness. I've been across the country. I'm very honored and proud to say that Montana's Adjutant General and their governor, I met with them this past September at their stand down. I'm just trying to get them to change their stand down to a stand up, but slow baby steps in government. But all of the changes that we have been advocating for here in Minnesota, they actually implemented in Montana. So that was a humbling experience to go out and meet with them again. I was out in California helping them and doing outreach with some homeless veterans there. See, our nest is far different from entities or regions or districts. We just take care of each other. Our veterans serve all of America, and that's how we take care of them. We have everybody from active duty members to National Guard, Marines, all branches have come to the nest. Most of them still fear and are being discharged based on asking for help, contrary to what rank will tell you. That is still happening today. I have one. And that's tragic. We shouldn't be standing in front of the news media telling them to come forward and then kicking them out with another honorable or dishonorable discharge. We've joined many hearts and hands over the course of the last few years, working together with other organizations that just do right by veterans. And it's working. They're trained in suicide intervention and prevention. They take care of it. It's different. A veteran, as well as their family, they all serve, and there's a huge gap, and there's huge holes, and they're falling down in them. You know, they're working on that, counting the homeless. The reality is a veteran won't tell you they're homeless. I've been dealing with homeless veterans since I was 8 years old. My father, Chuck Pounds, we hit the streets. So when I went to California and met with a foundation out there and their Veterans Court. I hit the same streets that he took me to find those that he served with. And there are still homeless, lots of them. And in Minnesota, I just met with Stearns County on Monday. Those counts are wrong, but we can't give up. And there's huge strides and many people joining hearts and hands. As you know, we came and things got tied up in the legislative things, and you know me, I'm not about checking a box or a whole lot of paperwork because I don't have a whole lot of staff. I just want to take care of veterans. And we waited and waited for roofing money, and that didn't come, and then waited and waited again for general operating funds, and that didn't come. But I just had faith. It was created on a wing and a prayer, and I can tell you at Christmas time that a Vietnam veteran donated, and as well as another Minnesotan. And so we will be starting next week repairing our roofs. That's what being part of a military family means, is you're given a task and a mission, just as Commissioner Shelito gave me when he was the Adjutant General. Don't come with the problem, come with the solution. So that's what we did, and that's what they're doing. And still about 90% of our veterans come from the VA system. Although they don't fund it, they don't necessarily like what I have to say, they do have some amazing people trying to do what's right within that system. It's just tied up in bureaucratic bullshit and red tape. That's the truth. The workers that we work with try really hard. Unfortunately, upper management doesn't allow them to do right by the veterans, and hopefully those things will change. But at the Nest, we just take care of each other. That's all we do. The veterans take care of veterans. They help law enforcement. Most of the law enforcement in Minnesota now comes and trains their dogs right at the Nest. We are substance-free, we're weapon-free. We follow mom's rules, and we follow the code of conduct in the military. And that's what they do. They take care of it all. We've got 3 going for their food management licenses next month. They take care of the grounds. They take care of the boilers. They renovate. They do all of it. It's a helping hand up. It's not a handout. It gives them purpose. They have a complete wood shop. This past Christmas season, they made toys and gave them to other organizations as well as churches to give to the children in need. That brought them great pride and purpose. They volunteer. They reintegrate back to their families. We don't dictate how long or short a stay they can have, whether that's 2 weeks until they can get into a program or whether that's 3 years for a Vietnam veteran that has been with us, that has made huge strides and works, but that's his home. It's where he feels safe. It's where he's been able to maintain sobriety. That's what the Nest is. That's what it does. It's just taking care of each other. When I was tasked with this challenge, and I had approached and asked way back when for help, I don't have all the answers, nor will I ever have them. But there was no time to wait. And we learn as we go. We pull our boots back up and we keep going. And that's what the veterans are doing. Our goal is to have a women's building called Lady Liberty open. Repairing our roofs will do that. They're training service dogs, their own service dogs and service dogs for others. They're working on a metal shop to teach a trade, working with some other businesses. So they are the solution, and their families are the solution. And I appreciate all the support that we have received in coming to the Capitol. Unfortunately, most of it gets tied up in red tape and we end up waiting, so we find up with another solution. But what you could help with is allowing us to grow. I get it's outside the box, and I get that the entities don't like outside the box, but it works. And for 4 years, it's worked. And when people ask how you operate, we purchased the property. It's in a charitable trust. It takes us about $43,000 a month to provide transportation and to pay all the bills. And we get most of that through the veterans contribute when they can. We've been blessed to work with Stearns County and the State of Minnesota Department of Health and Human Services to be able to accept GRH funding to receive that for them. Except there's a little problem with that when you can't get their doctors to sign off that they may need it, coming off of a suicide attempt or coming off a locked mental health unit or out of an addiction program for 30 days. There's not enough time. You're looking for a solution in a 28-day time period for combat veterans or for any veteran, to be quite honest. That's going to take a lot longer to do and for them to get on their feet. So most of our donations come in $5 to $100 donations. And I call that a blessing. And I call that many people joining Hearts and Hands. And we've had donations as far away as Okinawa and overseas. We just did a suicide intervention from an active duty member who served with someone in our National Guard unit. 22 days ago, he's been sober 21 days and getting programming now. So allow us to keep growing our way outside that box because it's working. I think I had one of the biggest honors out in LA County with the judges and the admirals and the foundation out there when they said to continue on your mission because it's working. And that's what's going to make it work for them. They're creating it. And they said, don't give up. And we never can. Thanks.
Thank you, Ms. Butler. Any questions from committee members? Senator Newton.
It's not a question. I guess if my mic was on all the time. Thank you, Ms. Butler.
Thank you for your
It's
service.
been a great journey with you for the last 4 years.
I think you gave me a nickname.
And for all of you on the committee, I really encourage you to go up to Sauk Center and see what they're doing up there for the veterans. It's an amazing program. If it wasn't for Ms. Butler's tenacious ability to latch on to people who were hesitant to help, I can guarantee that every one of you on this committee are going to know who she is before this year is over, because she will not let up, and she's doing an amazing job taking care of our veterans. So thank you.
Thank you. With that, on March 3rd, I'd like to extend an invitation at 10 a.m. The speaker and some others that have joined Hearts and Hands with us are coming up for a talk, a visit, and a barbecue. Come up and visit with the veterans. They'll tell you why it works. They'll be more than happy to serve you up a barbecue in their new giant barbecue grill that they've now made to help themselves have we used to use little barbecues, but now we have a huge one, probably as big as this table, that they helped make. So join us. An invitation will be going out today. Let them, it's their story of healing. I can tell you my story and how I got from 8 years old to where I am now, but that's not important. What's important is when you see that they have hope, or when they tell you that they have chosen to give back to others or to serve. Again, it's their story, it's their nest.
Members, I'll just let you know that there was money in the bonding bill last year that, of course, you know what happened to the bonding bill, but it's being carried over into the next bonding bill for the Eagles Nest. Senator Little.
Thank you, Chair, and I wanted to thank you for what you're doing and for your presentation, and for recognizing that not everybody checks that box. And there are a lot of people out there that we're missing in the data. So it's, I'm glad you're bringing that up. Throughout your presentation, you were kind of talking about outside the box, and it sounds like you might be worried about some requirements or restrictions that may currently exist or may exist in the future. Could you expand on kind of the things that you would not want to see?
Sure.
Thanks.
Ms. Butler?
Thank you, Senator. So that kind of goes back to my journey when I was little. So my stepdad and those that he served with, and he's a casualty of suicide 24 years ago now. And all those that he served with, he was the last one. But they all said one thing. They all feared the VA. That was the reality. They feared what our government had done when they came back from Vietnam. Those wounds take a long time to heal. And I see it every day, still today. We've had veterans from World War II, Korea, all the way to current active duty. And the stories are the same, and that same fear is building again, as you know, with all of the changes and the broken promises. That's what it is, broken promises that we made. So, you know, the clinical model has to follow that. We follow all the right, we're licensed as Board and Lodge and Board and Lodge with special services. Dr. John Sheridan, he was with Volunteers of America for their veterans and homelessness. Now he is all of LA County's mental health and homelessness advocate, director of all of LA County, and serves with the foundation with Admiral Mullen. This is the model that they believed will work, and I'm just blessed that they've joined Hearts and Hands with us long ago, and excited for their visit this spring. But when you have to check those boxes, they get left behind. They truly get left behind. So if a veteran is suicidal, their worst nightmare is to be locked in a locked unit, if they're asked at all. I just dealt with 3 last week that were taken. One was a family member who initiated a health and welfare check. The call was made. And 2 ended up, one through law enforcement and one through family on a locked unit. There was no suicide intervention and prevention. There was no evaluation done, and they were released. Where would they go? We have another one that we had to we're licensed for Board and Lodge, and Board and Lodge with some limited special services. We're not a hospice. We're not a dumping ground, nor will I let them use us as a dumping ground. Our veterans deserve better than that. Representative Newton, Dennis, that you met at the Nest, I spent 2.5 weeks with him at a local hospital on his journey back to God. He stayed with us at the Nest. He had no place to go. By checking the boxes, he had nowhere to go. The system that should have taken care of him didn't. And we were blessed with an amazing county veteran service officer and an amazing funeral home and Sauk Center, and he was buried with honor with a whole bunch of Patriot Guards. And we just had to battle that same battle last week, that they wouldn't accept a veteran into hospice care. Well, you take care of him. I can't. I can't give him the medication he needs now. But we still visit him. That's what happens when you check a box. Someone said, well, how do we know we're fiscally responsible? Okay, we're all Americans sitting here. Let's be real, we just had an election year. Americans there's a bunch of waste. I can show you what you use the money for. People say you've done extraordinary things. I didn't do it by myself. And we too are volunteers. I have one paid staff, and he came there to heal, to assist me. The rest are all volunteers. Mike's going across the country riding a motorcycle to raise roofing money. I hate turning veterans away or their family members. We had to find a way to replace the roofs, so we did. But we do follow what the law requires and the licensing requires us to do, and been blessed by a whole bunch of clinicians who have offered their services for the veterans. We have a traumatic brain injury doctor, and he actually came out of Fort Hood, retired, and came up here and licensed himself. And we know that we have a whole host. I don't think anyone is looking into the future. I just had that conversation with the commissioner the other day. People say, could you recreate this? Of course, that's why we're in Montana. That's why I'm in California. But my commitment, I could have very easily went. I've been given job opportunities to go and create a nest somewhere else with unlimited funds and not have to fight the fight to keep it going and wondering how we're going to pay the bills or keep our vans on the road. But that wasn't the promise that I made. Someone else may do that, but I'm not going to do that. So our commitment is to finish the one in Minnesota and help others. But you have a whole generation. There's a 3 to 5 year waiting list of veterans to get into the veterans' homes. There are no mental health beds available. There are no substance abuse beds available. And you have a whole generation of young veterans from the Gulf War, Iraq, Afghanistan that have traumatic brain injuries and PTSD, that group residential housing or facilities like ours are the solution. And those young vets have the availability and want to give back to the older vets. One of the things that I would hope and open up discussions, the commissioner and I were talking about that, was to have an assisted living where they are fairly independent, but they need a nurse maybe to help with their meds and maybe a certified nursing assistant to do that. Our veterans are willing to do that. You see, we've had to do that outside the box because they had no place to go. So we hope those are the type of outside the box we're talking about. We follow the rules. We just don't want any government entity or clinicians to come in and tell us how we have to live in our community.
Thank you, Ms. Butler. I appreciate your coming here, and my salute to you and to your others for your work behind the scenes. And we need to get up to see what you're doing. Thank you.
Thank you.
Next on our agenda is a presentation from Minnesota Assistance Council for Veterans, if they could come forward. Good morning. If you could state your names and proceed with your testimony, I appreciate it. Thank you.
Mr. Chairman and fellow committee members, my name is Nathaniel Saltz. I am the Interim Executive Director for Minnesota Assistance Council for Veterans. I've been with the organization since 2003, serving in the Interim Executive Director capacity for the past 10 months.
My name is Rebecca Geraji. I am the Director of Finance and Administration with MACV. I have been with the organization since 2012 and accepted the promotion to director level March of 2016.
First, thank you for inviting us to give an update on the programs and services that MACV continues to provide for Minnesota veterans and their families. We are a 501c3 and have been serving Minnesota veterans who are homeless or in crisis and at risk of homelessness for over 26 years, and look forward to continuing to provide outstanding services to the state. As some of you are aware, and for those of you who may not be, after an extensive and thoughtful search, MACV will be bringing on our new president, CEO, on February 6th. We are so thrilled to welcome Major General Neil Lloydolt to MACV. General Lloydolt's bio is included in your packet, and he looks forward to being a part of future conversations with you about our work. In front of you, each of you have a MACV folder providing documents about the programs and services offered at MACV. If you will allow me a few moments, I will provide a brief summary. But first, let me say thank you to the committee for the funding that you have provided to MACV. This funding has allowed us to fill the gaps and provides for key services in outreach and direct financial assistance to veterans and their families for housing, utility disconnection prevention, transportation, food, and other essential needs, and allows us the flexibility to move swiftly to resolve or prevent a veteran's episode of homelessness. MACV provides services to homeless and in-crisis veterans throughout all of Minnesota in the areas of housing, employment, and legal services. Our outreach includes 9 stand-down veteran services events throughout the state. We do not duplicate services. Rather, we partner with agencies, government, and nonprofit to make sure that all areas of need for our veterans to move from crisis to stability are being met. and we fill the gaps in these areas of housing, employment, and legal services. We partner closely with each county veteran service officer, tribal veteran service officer, the Minnesota Department of Veterans Affairs, and the VA, as well as the Homeless Continuum of Cares, to ensure that all eligible supports and programs are being accessed by the men, women, and families who need them. We also have formal partnership memorandum of understandings to provide services to veterans with St. Stephen's Human Services, Catholic Charities, the Salvation Army, Community Action Program of Suburban Hennepin, Volunteers of America Amicus, People Incorporated, Red Lake Homeless Shelter for Tribal Outreach, Housing Link, and several legal service corporations. We are proud of our creative and impactful partnerships. We maximize funding from federal sources, bringing grants to the state through the Department of Labor, 3 Homeless Veteran Reintegration Program grants, U.S. Department of HUD, 4 Continuum of Care grants, and the VA, 2 Supportive Services for Veteran Families grants and a grant in per diem, as well as corporate and foundation funds to carry on our mission. We are certified by the Minnesota Charities Review Council and are audited annually and throughout the year by specific funders. Our regional offices are in Minneapolis, Duluth, and Mankato, and from there we carry services to all 87 Minnesota counties. Key to success in all of our programs is the intensive case management each veteran receives along with the direct financial assistance. We assess each veteran for housing status, health and mental health needs, employment and income, appropriate housing, living skills, optical and dental care needs, and legal issues to develop the strongest stability plan possible. We own and operate 79 beds of transitional and permanent supportive housing, including housing in Duluth, Mankato, Minneapolis, St. Paul, St. Cloud, Richfield, and Maplewood. At the beginning of the week, that number was 77. We have just added 2 units of transitional housing in Mankato, so we're very excited about that. In addition to that, we partner with the Sand Companies to be the service provider for the 37-unit Linden Grove Veterans Apartments that opened this past fall in St. Cloud. We are proud that all units are occupied by veterans who needed that housing option and support. MACV provides rental, security deposit, mortgage, utility, transportation assistance through a variety of funding sources, including critical funding through the state, to rapidly rehouse homeless veterans and prevent episodes of homelessness for Minnesota veterans and their families. Over 90% of the veterans housed were still stably housed 6 months after completing MACV programs. Through our statewide employment grants, we work to stabilize veterans' income through employment. Through our most recently completed Department of Labor grants alone, in 2016, we placed 199 homeless veterans into employment at an average hourly wage of $13.22, representing annual gross wages of $5,393,377. 85% of veterans who got jobs through this program kept that position for at least 6 months. Our now 9 stand-downs in 2016 served over 2,200 veterans, giving on-site, same-day access to housing, employment, health care, veterans benefits, community benefits, and legal services providers, including a stand-down court. In 2016, we hosted 38 legal clinics in 18 communities across Minnesota, serving over 1,600 veterans, as well as providing full representation services to veterans whose civil legal issues prevented a direct barrier to housing or employment stability. This is key to long-term stability for our clients because oftentimes legal matters can be a serious and seemingly insurmountable barrier to stability, whether it's child support modification, housing law or employment law, or any number of destabilizing legal situations. Our vet law staff and partners are there to provide outstanding and nationally recognized services. In 2016, we provided direct services to over 1,725 veterans, 49% of whom were homeless when they came to us initially. Of those veterans, 73% had a disability, 33% are veterans of recent conflicts, 11% were women veterans, and 26% of those veterans had dependent children in their household. In partnership with the Minnesota Department of Veterans Affairs, MACV and our partner agencies we contract with for specific veteran services, we have been deeply involved and engaged in the functioning of the Homeless Veteran Registry, a by-name list of veterans statewide experiencing homelessness. The list allows for regular case management meetings on each individual veteran to develop tailored outreach and housing plans for everyone on that list. This past summer, the U.S. government announced that homelessness among veterans has dropped 47% nationally since 2010. In Minnesota, that number is 57%. We are proud of that success, but there is much, much work to be done. The veterans who remain homeless now are often the most difficult to reach and engage, with the most barriers. Housing these veterans, each and every one, and having the strong systems in place to both prevent new episodes of homelessness with early interventions and the ability to rapidly rehouse a veteran who does become homeless is our mission. Going forward into the year, we are excited to be adding additional staff in Rochester and St. Cloud as we continue to look at expanded outreach and housing opportunities for rural veterans, women veterans, and veterans with children. These are some of our communities of greatest need and the focus of MACV's future growth efforts. So to summarize, we fill the gaps. Some of the other programs throughout the state have very strict income guidelines. Even though a veteran has become recently unemployed, their income from the past 3 months may disqualify them. Others have restrictions based on disability or have a long lag time between program application and the assistance received. We're proud that our programs are rapid, holistic, and veteran-centric. We are statewide, non-duplicated services that leverage sources of funding, partner and collaborate closely, and bridge the gap for veterans in crisis. Thank you for the opportunity to present to you today, and I'd be happy to take any questions.
Thank you, Mr. Schultz. Members, other questions for the testifiers? Okay, thank you very much. I appreciate it.
Thank you, Mr. Chair.
Bet. Our last testifier will be a presentation by our fiscal analyst on the Veterans and Military Affairs budget for upcoming 2018-2019. Mr. Lundin, welcome to the committee.
Thank you, Mr. Chair. It's kind of a different feeling to be looking at you from this direction rather than being at the table. So what I hope to do today is just to kind of give a overview of kind of the appropriations and budget issues that we'll be dealing with in this committee. I'm not going to pretend that I'm going to be able to answer every one of your questions if there's something detailed. I've asked the budget and finance staff from the agencies to be here if there's something to step up to the table and answer if I'm unable to. I think it's important to kind of, looking at this area, our jurisdiction is made up of the two agencies, the Department of Veterans Affairs and Military Affairs. You can see it's a very small part of the total all funds budget, less than 1%. And you can see it broken down by fund. The general fund, it's $193 million. And then there's the special revenue, federal, and a small amount of gift. And when you kind of focus in more on the general fund, that's what we'll largely be focusing on as we write the budget bill. You can see that we are just 0.4% of the general fund budget, $193 million. And about 80% of that is going to the Department of Veterans Affairs, and 21% is going to the Department of Military Affairs. And then you can see the breakdown between the two agencies. And essentially with the Department of Veterans Affairs, about 75% of that general fund is going towards the veterans' homes, and with the remaining going to the programs and services area of the department. With military affairs, nearly 50% of the 39.8 that we give them are going towards the maintenance of the training facilities, and approximately 34% is going for the enlistment incentives program and also to pay for emergency services when the governor calls out the guard for some of the emergencies in the state. And here's kind of just taking a look at the budget, looking back to some of the previous bienniums and just seeing how much we're spending and some of the growth that has taken place. If you've noticed, between the 14-15 biennium up to the current 16-17 biennium, there has been some growth in the appropriations there. Part of that is due to, in the 2015 budget bill, we did provide a significant increase in compensation funding to the Department of Veterans Affairs, largely for the staff at the veterans homes. And so that was a large, accounting for about 17 million of the increase there. We also provided, or actually did a transfer of some money from enlistment incentives into the maintenance budget. That accounted for another 10 million, so that's why there's kind of a spike up there from the 14-15. This was some monies in the fund that were not being spent on enlistment incentives at that time. And then there were some one-time expenditures for some various studies and so forth. I think now I'll probably turn to the spreadsheet. I think everybody has a copy of it in their packets. And I'm not going to put that up on, I think it's easier to work from the paper for this. And I should point out, the spreadsheet is showing the general fund appropriations that we make, and then also the statutory funds that the agency has access to. And generally, the statutory funds are going to be the federal funds and the special revenue funds. The special revenue funds generally have a source of some revenue, whether it's fees or some transfers or something going into it. And then they have the statutory authority to spend those particular funds. Whereas with the general fund, they're largely directly appropriated, and those are the appropriations we will make in the budget bill that we put together later this session. So taking a look at the spreadsheet, the yellow column, which is the fiscal year 16-17 biennium, that is the enacted budget. We're in the middle of fiscal year 17 now. So there are the expenditures of 16, which are closed, and then what they're predicting that they will be spending in the fiscal year 17. And all of these numbers are based on the November 2016 forecast. We'll get an update at the end of February, and then that's what we will use those numbers at that time as we go forward building our budget in this committee. And then the 18-19 numbers, those are the base numbers. All the one-time appropriations and stuff have been taken out. Those are shown as appropriation numbers versus the expenditure numbers in 16 and 17. So sometimes when you do a comparison between back to 16 and 17, you have to realize that that may include some carry forwards, there may be some transfers going in and out of that. So sometimes it may distort the comparison a little bit. And then taking a look at the Department of Military Affairs, the first program there is the maintenance of training facilities. This is dealing with the 61 Army facilities and the 2 air bases. And you can see how the general fund direct appropriations are broken there amongst the 3 areas. And as I did mention, we did have the $10 million transfer from the enlistment incentives into the maintenance budget. So that's why when you look at the amount of spending on line 16 is significantly higher than the amount that we're carrying in the base. A lot of that is due to that one-time money brought forward. And then I just want to kind of move down and just kind of highlight in blue, I've kind of just highlighted the statutory appropriations. And as I mentioned, we will not be appropriating those in the bill, but I think it's important to be aware of other resources that the agency has available and kind of where they're coming from. The special revenue appropriations showing there are largely attributable to different revenues that are coming into Camp Ripley. They have some capital improvement revenue, and it also includes some of the interagency leases that they have. with the Department of Public Safety and the DNR. And then it also includes a small amount of revenue that they take in from the billeting at Camp Ripley. Moving down the next item, the federal, and this is largely the construction and maintenance money that the department gets from the federal government through their master construction cooperative agreement and their master cooperative agreements for the repairs and maintenance of the facilities. And I should point out each of the facilities has its own support code and basically the amount of reimbursement they get from the federal government for maintenance. Moving down the spreadsheet, we get into the general support area, and you can see the general appropriations. This is largely for the administration, HR, finance, project management, and those sorts of functions in the department. Also, just pointing out there is a transfer that comes out of this area to the governor's office. This is something with a lot of the cabinet level agencies. There's a transfer to pay for some of the policy staff in the governor's office. So I just kind of point that out. Moving down next, you get to the support our troops. This is a special revenue statutory appropriation. This is the $30 contribution on the license plates that goes into this account. And it's split between both the Department of Military Affairs and the Department of Veterans Affairs. And they're required by statute to give us an annual report on the grants that they've given February 1st. So that's something that we should be getting very soon. Moving down next is a small amount of special revenue that comes in from armory sales and the Camp Ripley timber sales. The next item is the federal dollars that come for the Starbase Minnesota, which is serving students in 5th and 6th grades, underprivileged students, kind of dealing with technology, engineering, math, and science issues. And that's totally federal money. We haven't provided any state appropriations for that in the base. And then moving down, next to enlistment incentives. And this is where I had mentioned in the 2015 budget bill where we did the one-time transfer of $10 million. And then there was also an ongoing redistribution of the base dollars there with an additional ongoing $3 million going into the maintenance area of the department, and then about $460,000 going into the general support. And I think when we had the department in here recently, they were talking about a forecast deficit that they were projecting in here due to some federal rule changes on eligibility and so forth. So I'm sure that's something that we'll be dealing with and something that the governor has made a proposal in his budget recommendations to deal with. Moving down next is the emergency services that I had mentioned. This is an open general fund appropriation. So whenever the governor calls out the guard for floods or fires or whatever emergency, whatever the costs are, the general fund will provide it. We will not provide a direct appropriation, but they have that statutory authority. And that pretty much sums up, in a nutshell, the budget for the Department of Military Affairs. Moving down the spreadsheet, the next to the Department of Veterans Affairs. First is the Veterans Services area, and kind of dealing with the administration. Once again, that's the HR, admin, finance areas of the department. I point out again the transfers that go to the governor's office, and sometimes there's other various transfers that agencies make as well that are included in that particular line. Moving down then to the programs and services. The first is the State Soldiers Assistance, which is providing housing, dental, optical, and that sort of assistance, special needs to veterans. There's the $200,000 for the biennium in for the Gold Star program. We provide the operating support to the state cemeteries. So this is what's reflected here is just the operating support. This is not any of the construction costs related to the cemeteries. And as we heard in the presentation the other day, and also something that's going to show up in the governor's recommendation, is the Duluth Cemetery will be opening up in July of 2018. So we'll be asked to provide some of the ongoing operating support for that. And then I think also in the planning there is for a cemetery in Redwood Falls, but we won't have to deal with operating costs for that this biennium. That's still in the planning. And then moving down, we have an appropriation to Link Vet for the counseling services. We have the appropriation for MACV, which we just heard about. That's $750,000 a year in the base. And then moving down to the bottom of the spreadsheet, turning over, we get to the administrative costs of the GI Bill. So there's a transfer that goes to the Office of Higher Education. We make an appropriation in the bill for $100,000 each year, and then that is transferred over to the Office of Higher Education because they deal with a lot of the administration and the implementation of this particular program. And then there's also $100,000 a year that stays within the agency to deal with their administrative costs of the GI Bill. The next item is the Minnesota CORE program, the caseworkers. This is $500,000 a year, and this basically is a grant that goes to Lutheran Social Services to deal with this. The next few items there are some one-time appropriations that were in the supplemental bill last year. There was a grant to the Cottages of Anoka rent subsidies. This was a proposal that originated in the House last year and was decided in the conference committee. The next is some grants through the State Soldiers Assistance Program for housing and health grants. This was also a House proposal that was picked up in the conference committee. The next is a veterans mental health study. This was a Senate proposal last year that was included in the supplemental bill. And we should be expecting a report from the department on February 15th. And then the next is a disabled veterans interim housing study. This was a proposal last year of Senator Clausen's that was included in the supplemental bill, and we will also be getting a report back on that on February 15th. Moving down next is the claims and outreach area. We have the Claims and Outreach Office, which is doing the advocating for veterans at the VA. We have the CVSO grants program with grants that are serving all 87 counties. We have the Honor Guard funding at $200,000 a year. We have the Higher Education Veterans Program. This is providing the staff at the campuses for veterans. And then we have the Veteran Service Organizations, which we had the presentation last week, and we provide grants of $353,000 a year to those entities. Moving down, you can see the Support Our Troops, statutory appropriation for the Department of Military Affairs. And then next, there's a special revenue account set up related to the cemeteries and basically where they deposit any revenue related to that, burial fees and so forth. There's a small account set up next for the on-the-job training program where the revenues are deposited there. The next appropriation is related to the Preston and Duluth cemeteries construction. This is federal money, and essentially what's showing up there is the construction money the state's gotten for the Duluth cemetery. And then there's also some federal money that comes for the state approving agency. And then as we move down the spreadsheet, there is on line 128, the GI Bill. You can see there, and these appropriations are open appropriations. We will not make a direct appropriation for them in the bill. They're set up statutorily, and there's a cap on the open appropriations. I believe it goes up to about $6 million a year. So you can see that we're not bumping up against that cap. They're predicting about $3 million a year to be spent between the GI Bill and the on-the-job training and apprentices program. Next, moving down, is the Veterans Health Care Program in the agency, and this is where the veterans' homes are housed. And what I've broken out here, you can see the general fund appropriations and how much is roughly attributable to each of the homes and for the administration costs. Once again, I'll just point out there is that transfer going to the governor's office there too out of that appropriation. So when we make an appropriation, it's a general fund appropriation, but we do include rider language in the bill that allows the agency to take the general fund appropriation and transfer it to the special revenue fund. And in that particular account, it also includes the VA per diems from the federal government as well as the resident maintenance charges. So the expenditures that show up, I have had the agency help me break out how the general fund in 16 and 17 broke out amongst the general fund so that we could kind of get a feel for where those dollars were. But when they show up as actual expenditures, they are out of that special revenue account and not showing up as general fund expenditures. And I think I did mention that we did put in a significant increase there to cover staffing costs last biennium. And another item I should just point out from the 2015 budget bill, there was language requesting the Office of the Legislative Auditor to kind of do a review of the financial management of the homes. And at some point, we may be getting that information from the OLA. I'm not aware that it has been completed yet. And then just moving down the spreadsheet, the Special Revenue Fund, that is basically the rest of the home's money that's attributable to the per diems and the residents' maintenance charges. And there's also, for some of the rental and lease fee revenue they may get from the homes is also put in an account in the special revenue. There's also a gift fund where people may make donations to the homes, cemeteries, memorial matches, things like that kind of come in and they just go in the gift fund and are spent from there. And then the federal statutory appropriation, what this is referring to is some of the construction money that the state has received. And these dollars are largely, have been used towards the Minneapolis Veterans Home, largely towards buildings 21 and 22. And so I think that pretty much sums up the budget for the Department of Veterans Affairs. And I think I just have a couple more slides. I was just going to touch briefly on what the governor recommended yesterday, and I think I'm just going to present them, but I'm not going to go into any detail explaining them. I think we'll hear from the departments later on their recommendations. One of the recommendations that the governor included for military affairs was to transfer $2 million from the maintenance training facilities program back to the enlistment incentive programs to deal with the deficit that they are going to be experiencing in fiscal year 17. And the governor also recommends increasing the enlistment incentives program by $11.536 million for the 18-19 biennium to deal with the issue on an ongoing basis. The governor also included an operating budget increase of $178,000 for the biennium. This is to deal with, increased compensation costs related to pensions, health care, labor agreements, and stuff like that. The next were the recommendations that the governor had for the Department of Veterans Affairs. The governor is proposing an expansion of the GI Bill to enable it to pay for licensing, certifications, and testings. So there's an additional cost which would be booked under the open appropriation of $400,000 for the biennium. The governor is also requesting $1 million for the biennium for the operations of the new cemetery in Duluth. Next, the governor is requesting $2 million in one-time funding to deal with the repairs and betterments related to the veterans' homes and the cemeteries. And then the governor is also requesting an operating budget increase of $2.265 million in 18 and 19, which is to deal with the compensation costs that I had mentioned earlier. And then another proposal that the governor has is free hunting and fishing licenses for the 50% service-connected disabled veterans. And this is something where, you know, the cost to this would be dealt with in the Environment Committee, because the cost would be to the DNR. There wouldn't be any cost to our particular budget here. And Mr. Chair, I guess that's the overview. If there's any questions anyone wants further information from the department.
Thank you, Mr. Lundin. Members, do you have questions for the testifier? Senator Newton.
Thank you, Mr. Chair. Mr. Lundin, on the enlistment incentives, and the governor's asking for an increase of $11.5 million. Are we having trouble getting people to enlist in the Guard and the reserves?
Mr. Lundin.
I think the reason for the increase is with a change in the federal policy has made it a bit more difficult to access the federal funds with some of the changes. So I think it's put more of a draw on the state dollars. And so that's why the agency has been forecasting a deficit there. So I think this is to deal with that ongoing, what they see as a greater draw on the state funds. But
okay.
Senator Newton.
Thank you, Mr. Chair. I think maybe at some time Mr. Kerr could help us with some of that information. A general question relating to the state cemeteries, Little Falls and Preston, and the new cemetery in Duluth. Are they restricted? Are the people buried there restricted to the state of Minnesota, or do they draw from a wider area? Do we know?
Mr. Lundin.
my understanding it is the state of Minnesota, but I guess I'll ask for clarification. It seems like they're nodding their heads
Okay.
back there, so it
Good.
is state of Minnesota.
Thank you.
Senator Newton.
The third one has to do with the post-secondary education assistance bill. And we've got a cap of 6 million, but we never really fully use that amount. Are there restrictions on that? I'm looking at the possibility of a bill to provide for interpreters, Iraqi and Syrian interpreters who reside in Minnesota, to use a portion of that bill, providing that we don't deny veterans, the benefit for it. And I would hope that from the Legion, the VFW, and the other organizations, and the Department of Veterans Affairs and the Adjutant General's office, that we can get some understanding whether that's something that we should be going forward with. I also know that Representative Rosenthal in the House is proposing something similar, but it would be a minimal amount, and it wouldn't interfere with the amount that we've got. We've got a $6 million cap, and we're only using $2 or $3 million a year. So thank you, Mr. Chair.
Mr. Lundin.
I just wanted to point out one thing on that particular appropriation. It is an open forecasted appropriation, so the $3 million you see there is what we have forecasted in the November forecast that will be spent. So if there are additional changes made in eligibility and so forth, we do have to book those costs. When I mentioned with the one proposal that the governor had to pay for the licensing, certifications, and testings at a cost of $200,000 a year, when we get our target, we're going to have to book that because those costs are above and beyond what is in the forecast.
Other questions, members? Well, thank you, Mr. Lundin. We have our job cut out for us coming up for the next. Are there any comments from the audience that would like to? Mr. Tesla, would you come forward?
Thank you, Mr. Chair. Members of the committee, I'm Randy Tisdall. I'm the state adjutant to Minnesota's American Legions, and thank you very much for the overview on the budget. The Commander's Task Force, which is made up of 9 of the nationally chartered, congressionally chartered organizations, supports the budget that was just presented to you for MNDVA, and We actually, one of our specific agenda items, the pet licensure for 50% and above through the DNR is one of their requests from the CTF. I urge you to remember that when constituents come forward from communities asking for veterans' homes and cemeteries in their communities, that those come with tails. Even though there are federal dollars that come in to help create those places, there will be tails connected to them. And there are caps on veterans' homes. So we just urge our legislators to work closely with MNDVA on all the requirements when adding veterans' homes and adding cemeteries throughout the state. We're in a very patriotic position right now in the United States, which is a good thing. Separate in a 180 from what the Vietnam veterans returned home to. And everyone wants a veterans home in their community, but that's just not practical. So please work with them on those issues. I want to stress too, budget related, that there's a bridge that needs to be fixed and reopened to the Minneapolis Veterans Home. I'm going to guess that most of you are familiar with Minnehaha Park. You ever been there in the summertime and had to drive off of 46th Street into the Veterans Home area? It's a winding road. It's a 10-mile-an-hour limit. When the parking for Minnehaha gets overflowed, they park on that back road. There's those four-wheel bicycles that 6 people can all pedal. You get a couple of those and a bunch of cars on there, a fire truck will not make it into the Veterans Home, period. It will burn to the ground. We need that bridge. That bridge needs to be built. It's a straight shot right from Minnehaha Park right on to the campus of the Minneapolis Veterans Home. One last thing I want to bring to your attention is you've seen both ends of the spectrum on veterans housing today. MACV at one time was where Melanie and Eagles Healing Nest is today. Melanie needs help. She's filling a gap that isn't filled by the VA. When she refers to check boxes, she refers a lot of times to the veteran doesn't fit in a box. By statute, in order to use certain facilities, you have to have 181 days of consecutive active duty service to be, by statute, a veteran in the state of Minnesota. Some of those veterans don't. You have to have an honorable discharge. A lot of the folks that she takes care of do not have an honorable discharge. During the Vietnam era, if you came back to garrison and you had some mental health issues and you decided you weren't going to shine your boots and your brass, and you told the senior NCOs to take a hike because you had been through some pretty tough stuff over in Vietnam, they gave you a bad discharge and sent you home. They started out the war that we're currently in doing the same thing early on. They were sending people home with bad discharges if they were unable to adapt, but not considering the fact they had maybe had exposure to severe combat, or they'd been in an IED or some traumatic brain injury. None of those were considered. So we have veterans out there with bad discharges that don't fit in the box. She's filling that need. But what she really needs is to work through the other frustrating piece is grants. She has no financial expert. I work with a grant that was just talked about for the veteran service organizations, and I have a full-time, professionally trained and educated finance person to navigate through that grant. Grants are difficult. They're not easy to get, and they're even harder to utilize. You guys have given Eagles Healing Nest $300,000 and other dollars. It ends up sitting there because she doesn't have the expertise to manage it or administer it. And I think if we look outside the box, we need to look outside the box to help find a way to do that. Because MACV was there back in the 90s and the early 2000s. MACV, you had Jimmy Collier and a couple of people, all they wanted to do was, don't tell me the rules, I just want a place for veterans to get housing that don't fit in the box. So you've seen both ends. You've seen where Eagles Healing Nest can be in time. And I just wanted to point that out to you. You've had a great opportunity today to see both ends of the homeless situation in Minnesota. The American Legion does support both MACV and the things that she's trying to do there at Eagles Healing Nest. Thank you very much.
Thank you, Mr. Tesdall. Any other questions or any comments? If not, the Military Veterans and Veterans Affairs is adjourned.